Steve, what's going on?
Not much, man. How you doing?
Doing well. Are we wearing the same
Probably.
sweatshirt right
I was
now?
just thinking that we both underdressed for the occasion. I'm on the road
I
right
know.
now,
Is
so
this looks the same? I got to tell you, are these the? If so, it's very comfy. Um, Great to have you on the show here today. Last saw each other at HLTH, which was a great event. I know you were in the redesign area, which was awesome. And then just wanted to continue the conversation here. So I'm hoping for a lot of our audience, this will be the first time they're hearing about you, obviously through our lens. But my favorite people to reach are the ones that maybe haven't heard of you yet, and now you get to tell your story. So let's kind of take it from the top, if you don't mind. Like, tell the audience a little bit about yourself before you were at Troupe, and then post or since starting the
yeah,
company.
no, sure. Happy to, and happy to be here. Yeah, been an entrepreneur, been in healthcare all of my career. Started off in healthcare services and non-emergency medical transport space in the ambulance business, and built a couple of companies in that space. Really. Really challenging businesses, right? When you're running a healthcare services, they're commodity healthcare services businesses, and the way I learned to build a company was the way you thrive in that type of business, which is running as lean an operation as possible, and providing outstanding customer service, right? And really focusing on sales and pipeline and biz dev, and that's, I guess, kind of been the foundation of how I look at any company I've ever built or been a part of. Made a transition to digital health. Was more recently, I was chief revenue officer of a really awesome company called UCM Digital Health, which is a virtual care company based in upstate New York, which is, I think, where I was at when we met a few years ago. Yeah, and I had started a telehealth company really early in the space. So this was, what UCM had that was really exciting to me was a mobile integrated health side of the business, kind of the convergence of my background, where we were doing, virtual ER avoidance and urgent care, and then we could partner with a local EMS agency to send them into the home for, on the front end, ER avoidance, on the back end, like post-discharge readmission reduction programs. And I just get really excited about. I think it's a huge opportunity for companies that bridge that gap between virtual care and brick and mortar care and bring care into the home. But similar to the ambulance business, right? You have the windshield time, which makes it really hard to scale and have the unit economics make sense. You're not loaded with a patient. You're not billing for that time, right? You're still paying the driver's gas, insurance, vehicle expenses. So after I left UCM, I was trying to figure out what to do next and was looking to start something. And I was always a big fan of redesign. I had a lot of friends there, and and the leadership team, and some other CEOs. Love what they were doing. Love just incredible amount of innovation they were just doing in this space, and just trying to disrupt so many different channels within healthcare. And then this opportunity for Troop came along, and the concept that they initially vetted and funded was clinical wraparound services for senior living communities, and a care coordination and communication platform that created a source of truth, connecting the residents and their family and the caregivers, external providers, and the senior living staff. And the more I learned about senior living, it was pretty fascinating. They're a real estate and hospitality business. And the people moving in think they're moving into healthcare businesses, right? So there's a very big gap in both care and expectations, and also a huge business opportunity. And to my kind of point earlier of what I was looking for, of bridging that gap of virtual and in-person care, senior living, you might have 50, 100 plus people under one roof, right? So now it's the opportunity to get really creative and provide in-home care at scale. So yeah, so kind of jumped in, and here we are, almost a year and a half later.
And I think we connected when you were just kind of getting things rolling, right? Like in the very, very early stages. And then, as you mentioned, we met when you were at UCM Digital. And that was, I think, at a Nixon Gwilt
Like a happy hour, yeah. I think, yeah,
event.
and also
Yeah.
there
At,
was a HLTH in Boston.
it was HLTH 2021 at the, oh God, what's that hotel?
Right.
Yotel, bottom floor.
Yeah.
Yeah. I like that. That was a good HLTH because Boston's so easy to walk. That whole seaport was so easy to go to all the happy hours and stuff after the event too. Um, it's kind of the outdoor version of what we have in Vegas, right? Because like that little area of Seaport where that's all under the
Yeah,
Venetian, essentially.
yeah.
Anyway, so you've been doing this now for a year and a half. Let's talk about maybe some of the key learnings since you started that have maybe been the most notable, and then maybe how those have impacted where you'll take the business from here.
Yeah, I mean, a few things. We obviously we validated a lot of the initial research and thesis that there was a huge need, right? I think when people move into a community, they have less access to their primary care doc, to their providers, and as an industry, I mean, there are certainly some really exceptional senior living operators focused on clinical support, but as an industry, there's not a lot of clinical support on site, right? So those gaps have been leading to a reduction in length of stay by I think as much as 3 months per resident in the last 5 years, which is absolutely devastating to an industry whose primary source of revenue is rent. So we're really kind of we're on the ground trying to reverse that trend. So we've had a pretty warm welcome from our initial clients and partners, and um, been super fortunate to build a really great team, especially our frontline clinical team. And residents just love them. They love seeing them come in the building, come in their rooms. We're getting nearly 100% engagement. With the residents we're working with, and what we learned was, there's really two challenges. There's access to care and care coordination, right? So we're in care delivery, right, and care coordination. So we're kind of tackling both, and now leading into the care coordination side of things, because that's where the biggest gaps are, and that's where things slip through the cracks and people end up in the ER. When I was in the ambulance business, the general rule of thumb in a sniff was, when in doubt, send them out. If anything happened, they'd pick up the phone and call 911 or call my company, which was great for us then. But now we're trying to reverse that. We're trying to change behavior and add other lines of defense in between, and have a trip to the ER be that absolute last option. So we're having great outcomes. We're already extending out the stay. We're reducing ER visits. People are thrilled. We're integrating point solutions. There's a lot of really amazing. Well, so let me back up a step. That care coordination platform I told you about, that's expanded. We learned that the care coordination needs of any resident almost always falls on the health and wellness director at a community. And the title varies by operator, but there's always somebody in most of these communities that's responsible for the residents' needs, whether it's scheduling a follow-up appointment or coordinating a test and lab results, updating the family, and so on. And these are really, really important. It's a really critically important role. I think resident and family satisfaction with a senior living community often almost entirely depends on the quality of that wellness director. And so now we're building that care coordination platform has evolved into our AI enabled wellness director, right? Where we're building technology to really help streamline their workflows and streamline all the care coordination needs of the residents we work with. And then also plugging in point solutions. Like we're partnered with some of the leading, fall detection and lab companies. A lot of amazing solutions being sold to senior living operators, but they have, two really big concerns about them. One is that's just one more alert going to my already very busy staff. And second is liability. Now you'll have proof that we knew something was brewing, and if we didn't respond in the right way, they could be liable. They could be on the hook. So we're having all those alerts and notifications come to us, and then we're embedding a real time clinical response that seems to be really, really well received, and really really exciting, and been told by a lot of people that are very, very with very deep experience in this space and in senior living, that like this is the missing piece, right? That'll hopefully tie everything together, ultimately working towards bringing value-based care the right way into senior living, and figuring out how to way to incentivize the senior living operators to play a role in keeping people healthy and keeping people there longer.
Talk me through, Steve, like in an ideal world, what does 5 years from now look like in this space?
So, well, first of all, I think that I think senior living as an industry, both the real estate management and then trickling down to the healthcare services and tech solutions, is a massive investment opportunity. I think if you look at potentially as exciting as an AI, but it's not sexy, right? So you don't hear about it a lot, but if you look at the needs, right, there's let's say 900 plus thousand beds in the country today. The demand is projected to grow, I think, to about 1.7 million is the last I've read by 2030, which is only 5 years away. So the industry is going to double in size. I've heard that the um, supply demand is going to shift. The industry got hit really hard by COVID and by high interest rates, but things are now starting to ramp up with growth. And then I think supply demand shifts around late 27, 2028. So you're going to go from having, vacancies to waiting lists, price increases. And, these communities will hopefully have a lot more resources to invest in the clinical support and the solutions that help people just age in place and stay healthier longer. Um, so I think it's a huge market, huge growing opportunity, literally by the day. Um, but really, the trick is value-based care. It's like, how do we senior living operators? They know this, and they're in a powerful position to really impact, this phase of somebody's life, right, and help keep people, out of a long-term care facility, out of a skilled nursing facility, like keep them healthier in an independent type of setting where they really could thrive and enjoy this, their golden years. And if we could figure out a way to structure like the arrangements or provide the senior living operators with their share of the shared savings for the impact that they're having and keeping people in place, right? Then that's a game changer. Because now they could afford today, right? They have the real estate expenses. They don't necessarily have the additional, rent or revenue to pay for all the healthcare needs, right? So, this would sort of, I guess, allow them, empower them to provide their role, and then we hope to be that kind of turnkey bridge and solution, really to help them, really thrive and excel at it.
Do you think when we think through these senior living communities, we'll also start to be even more proactive? I'll give an example. I have some elderly relatives. They've been trying to find a place that they like, that they want to move into, right? Um, they can't find it. It seems like everything's either they're in the process of building it, or it's do you think we'll even get more proactive with care even in the future beyond that, where it's like um, people will pick like the community that they want to be in, these senior living communities, also based on like the healthcare and like the additional structure that's provided? Like how important will that come into the
Yeah.
decision in the
Yeah, no,
future?
that's a great question. So I won't go into too much detail, but we're working on a
Hmm.
pretty exciting, potential partnership with a big health system where we um, send people home being discharged to a senior living or a post acute community with Troupe, um, and then we expand from there. Ideally, the way it works today, it's there's again, like, not to name names, but there's some pretty powerful lead gen companies that really kind of control a lot of the leads and the sourcing. And so when somebody Googles senior living, certain websites pop up, they enter their information, and it's a free service to the consumer. But there's a lot of money changing hands on the back end, between the lead gen company and the senior living operators for a qualified lead. um, it's not, we want to set it up so it comes from a trusted source. Like, if somebody's being discharged, usually there's a triggering event, right? Somebody broke their hip, somebody's somehow getting older, and now the discharge planner or social worker says to the patient or the family, hey, maybe it's time to consider a transition to a community where you could have more support, more eyes on you. And we're trying to create a world where that referral source, whether it be a primary care doc or a discharge planner or somebody in a health system, is really leveraging data to steer them to the right community. Say, hey, listen, this is based on your price point, and like, by us having this partnership with a health system, for example, we, a year or two in, we could go to them and say, hey, these X number of communities by far, exceed, the care and of the others, right? We could measure and track very carefully who's, length of stay and the quality of service and support on site, and then hopefully steer people based on their very specific needs. Budget is obviously, it's a private pay um, product, right? But yeah, like, we're trying to do exactly that and really help people make decisions based on what's the best option for them, not necessarily the best, you know, qualified lead, right? If that makes sense.
Yeah. What's next, Steve? Talk me through. what really excites you as we head into 2025 now?
Yeah, we've spent the last year, really focusing on our clinical model and product market fit, and have a lot of great traction and some partners. We have a very robust pipeline. So two things, right? In 2025, we're going to be hyper focused on. One is, well, three things I should say. One is further penetrating the communities we're in. And getting deeper and onboarding. We ideally want to get every resident in a building so we could provide our services at scale. Um, that takes time, right? You got to meet the residents, you got to develop trust, you got to have a presence in the communities. Second is the more we're fee for service today, right? So the more services we're providing, the better care people are getting. So how can we kind of maximize the services we're offering to kind of what we call our Troupe Health Age in Place program and figure out which resident needs which codes or services and maximize that. Secondly is launching in other communities and open up a couple of other states and new markets. And finally is now that we know what to build, we're building out that AI enabled wellness director platform, and that's where a lot of our investment and tech resources will be spent on automating and leveraging technology to streamline the care coordination needs within a community, but also optimize our own clinical workflows. Because today in a fee-for-service world, we're billing time-based codes, right? So we need to log X number of minutes. But I envision a world in value-based care where we're paid on the outcomes, not on the number of minutes. So we're building that technology and leveraging AI, LLMs to really make ourselves as efficient as possible. So we're set up for success.
I love it. Awesome. Steve, I want to thank you so much for joining me here today. Look forward to future conversations. Please keep us in the loop, anything that's happening, but wishing you the best of luck.
Appreciate it.